Hello, my name is Samantha Holinsky. I'm a registered nurse at Rutland Regional Medical Center. I'm here today to show you and teach you about the COVID-19 journal. This journal was developed by healthcare professionals and members of our community to provide you with some information on COVID-19. Please follow the instructions provided to you by your primary care provider or healthcare provider, in addition to any information you may read in this journal. The purpose of this educational video is to provide you, your family, friends, and support system information to help support your recovery at home. There is a great deal of information in this journal. However, we are only going to focus on the most important points as you start your recovery. It will be helpful to follow along in your personal copy of the journal, as it will help you when you return to review the information later. On the inside cover, you will notice there is a QR code. The QR code is for this video. To use a QR code, turn the camera on your smartphone or smart device. Place the camera up to your QR code and it will take you directly to the link where you can watch this video again. Let's get started. We're actually going to start on page 3. We're going to talk about infection control first. As you've been diagnosed with COVID-19, it is contagious, and it is important to keep those around you safe from catching COVID as much as possible. As I'm sure you are aware, it is crucial to wear a mask at all times in public or at home when someone else is present. Social distancing is considered 6 feet with our masks on. Hand washing is the second most important way to prevent infection. When we sanitize our hands, we want to wash them with either soap and water and dry them well, or we want to use a hand sanitation product with at least 60% alcohol. When washing our hands, we want to make sure we get all surfaces, including the palms, in between our fingers, our fingernails, the tips of our fingers, the backs of our hands, and our wrists. Allow the alcohol to completely dry on your hands. Since you've been diagnosed with COVID-19, you are on home isolation. Home isolation separates known sick people from those who are not. Home isolation is a minimum of 10 days from when your symptoms start. Only when you meet the criteria set forth by your state will you be able to come out of home isolation. Inside the front cover of your journal, you will notice that we have listed the Vermont State and the New York State Departments of Health. I urge you to refer back to those for your state's specific guidelines. Any contacts you have had around the time of your diagnosis may be required to quarantine. This isolates people to see if they become sick so that COVID is not spread in our community. The Department of Health will be able to provide more support around isolation and quarantine. Now we're going to go back to the beginning of the journal, and we're going to start with page 1. Important numbers to call. Listed here are some typically used numbers when going home with an illness. Please feel free to write in your own phone numbers, or your healthcare team may have added some additional numbers in case you need to contact them for more information or you have questions. Page 2 has information on what coronavirus is and your treatment plan. Your treatment plan is 3 steps. The first step listed here is monitoring your symptoms. Monitoring your symptoms at home is important so that you can tell from day to day how you are improving or when to let your healthcare team know if symptoms worsen. Number 2 is medications. It is very important to take your medications exactly as prescribed, and if for some reason you're not able to take them, to let your healthcare team know. Number 3, rest and nourishment. You need to let your body heal with rest and provide food and drink to help in your recovery. Moving on to page 4 and 5, we are going to talk more about symptom management. As you will see on page 4, there's a page that looks like a stoplight. It's green, yellow, and red. If you follow along with me in the green zone, that's a good day. That means that you have no fever or chills, that you have no confusion or sleepiness, no fast heart rate, no increase in any pain, no discoloration of your skin. And so your plan, when everything is going well, is to continue doing what you're doing so that you can continue to heal. In the yellow zone, that's when we take caution. We pay a little bit more attention. Today, I may be running a fever of 102 or higher that is not relieved with the use of Tylenol. You would want to try Tylenol as prescribed by your healthcare provider. And within a couple doses, if it doesn't seem to be bringing down your fever, you will want to let your healthcare team know. If your heart feels like it's beating fast, that's another symptom that we want to watch out for. If you're having low energy, feeling more short of breath, or having increased trouble breathing, or if you have increasing or unexplained pain, those are all symptoms that you want to pay more attention to and take caution. The red zone. The red zone is where we start thinking about an emergency situation. It's when we need to take action now. If your fever has lasted for more than 24 hours at 102 or greater, your oxygen level is less than 88%. Skin discoloration. If your family or yourself are noticing that you have a blue tint or your lips are starting to change color. If you're having increased trouble breathing or your blood pressure is checked and the top number is less than 90 systolic, that's your top number, or greater than 180. If your heart rate is greater than 115 while you're resting, or you feel dizzy or lightheaded, your mental status has changed. You're more sleepy, you're less alert, or you're feeling confused. Signs of bleeding. Many patients with COVID-19 may need blood thinners or anticoagulation to help them recover. If you have signs of bleeding, such as vomiting or coughing up blood, or blood in your urine, black or red tarry stools, abnormal vaginal bleeding, or bleeding you cannot stop, these are all medical emergencies and you should seek help in the emergency room. Now we're going to go to page 5, where we have our symptom tracker. And this is a way for you to track your symptoms to either measure how you're improving day over day or how your symptoms are changing from day to day so that you can identify if your symptoms do worsen. On this example that I made, I said that my temperature was 98.7, my oxygen was 94%, my heart rate was 88, and my blood pressure was 100/90. I was feeling very alert that day, and so I referenced back to my stoplight and found that I was in the green zone for this day. So then I circled my green zone and realized I just needed to continue doing what I was doing because things were going well. As we moved through the days, I did notice that I started to run a fever. And after 24 hours of fever, I would be in the red zone at that point. But up until that 24 hours was met, I would still be in the yellow zone, as long as I didn't have any red zone symptoms. The next page in our journal moves on to medications. And for that, I'd like to introduce Melanie McAtee, our pharmacist.
Hi, I'm Melanie McAtee, a pharmacist here at Rutland Regional Medical Center. Today, I'm here to discuss with you the medications that you may go home with after testing positive for COVID-19. This information can be found on page 10 of your journal. Some of these medications may include blood-thinning medications to help decrease your risk of developing a blood clot. These medications are Eliquis or enoxaparin. Enoxaparin is an injection. To learn how to administer enoxaparin, it can be found in this section here. There is a QR code that you can scan to get more information on how to administer enoxaparin. The next medication is acetaminophen. You may use this medication to help relieve pain and to decrease your temperature. On page 12, you will find information regarding albuterol. Albuterol is a medication used to help open your lungs. This medication comes in a variety of forms. The first form is as an inhaler. You can connect to a spacer device to help slow down the medication to make it easier to inhale and to allow it to get deep into your lungs. Another option is using a nebulizer device. This can also help the albuterol get into your lungs to make it easier to breathe. For more information regarding how to use each form of albuterol, plus using albuterol with a spacer device, there are clear instructions here. We also have a QR code to show you how to clean your albuterol spacer and the nebulizer device. On page 14 of the journal is information regarding dexamethasone, a steroid. There's also information on over-the-counter products, including herbal supplements. And finally, on the bottom of the page, you will find additional medication-related information. This includes what to do if you miss your medication. One thing we recommend to help you remember to take your medication is using a pill box to help organize your medications. It is very important that you take your medications exactly as prescribed.
So now we're going to move on to page 15 in your COVID-19 journal. There are two sections to this page. The first talks about home oxygen, and the second about using your pulse oximeter. At the bottom of each column, you'll notice there is a QR code. Please scan it with your smart device, and you'll be able to see a video from the manufacturer with instructions on how to use each product. On page 18, there's information on the COVID-19 vaccinations. We encourage you to once again check with your state health department for the latest instructions and the CDC website. At the bottom of this page, we have provided 2 QR codes with more information on COVID-19. The last page of our journal speaks to having a successful telehealth visit with your healthcare provider. Please review this information and even access the QR code so that you can watch what a successful telehealth visit looks like. I'd like to thank you for watching this video today and reviewing the COVID-19 journal. The important points that we'd like to review are infection control. Please review the sections on how to keep yourself safe as well as your loved ones. Number 2, your treatment plan, the 3 steps to take. Monitoring your symptoms, taking your medications exactly as prescribed, and giving yourself the time for rest and nourishment so that your body can make a full recovery. We wish you a speedy and successful recovery, and we thank you for your time.